Hey, Martha, how are you?
I'm good. How are you?
Good. So, Martha is one of our nurse practitioners in our Powell office, and she's joining us today to talk a little bit about sexual wellness and the aspects that we approach or how we approach sexual wellness in our office. And so, I'd love to start, Martha, with just asking you, what is sexual wellness and why is it so important?
I view sexual wellness as kind of having a positive attitude, a respectful attitude and viewpoint of yourself and your body and your partner. Sexual health affects us physically, mentally, emotionally, socially, and spiritually. So it's very important. It's a huge aspect of our lives. One of the things that I think about as far as a physical response is just an ability to orgasm. Orgasms are really important. And when you have one, you get a release of a couple of hormones. You get oxytocin, which is super important. It makes us feel close to others and it promotes that feeling of affection. You
Mhm.
also get a release of endorphins, which are part of your feel good hormones. So it gives you a sense of well being. So
Mhm.
that's really important. And we should all be able to have one.
Absolutely. Tell me a little bit about how functional medicine, that approach to sexual wellness and what we do at Vitality.
Well, I think what's important to note is that, as we age, and for some people, this can start in your 20s and 30s, your sexual health can decline or suffer. And sometimes we don't know why. So it's really important to kind of tease that out and figure out what's going on with your body. Some people will report, for example, vaginal dryness or dyspareunia, which is painful intercourse. Men can have erectile dysfunction. You can have laxity of your pelvic muscles of the pelvic floor, urinary incontinence or loss of libido, or again, the inability to have an orgasm or limited or difficulty having one. So it's really important, in a functional medicine space, we go well beyond. I don't think this is well addressed sometimes in primary care or even in some of the subspecialties. And we look at the root causes for some of these problems. We do a really thorough history and physical exam. We look at some specialty testing and labs, and so we can kind of tease out, why is this happening? What's
Sure.
going on with your body? Sometimes it's from inflammation, oxidative stress. Sometimes it can be some genetic things or anatomic things that we can look at. And so I really like the fact that we look for common and root causes and then take it from there. We've got really cool, innovative therapies and treatments that can really help people to have a better sexual health and sexual experience. Some of those things, what we offer here at Vitality, would be peptide therapy, which is really neat, sexual health procedures like PRP, which is for vaginal and penile rejuvenation. That's a
Mhm.
really cool procedure. Thermiva for laxity treatment, and then hormone optimization. And when I think about PRP, I love PRP. There's a very low side effect profile. We're basically taking your blood, we're spinning it down and separating the serum, and we give you back, the granules, if you will, that are loaded with platelets and growth factors and stem cells, and they help your own body to develop a new and better network for vascular support, so blood vessel support. So getting improved blood flow to the genitals and to those areas so that you have improved sensitivity and again, an improved ability to orgasm. Um, the PRP procedures are really important and helpful for men. They help with sensitivity and erectile issues. And for women, it can even help with sensitivity again, but also with urinary incontinence.
Okay.
So yeah, I'm a firm believer in the PRP. I love it.
Yeah. So obviously the treatment for men and women is a little bit different. Can you speak to like comfort level or how long it takes for results or anything like that?
Yeah, so the results vary, and
Mhm.
we've done a lot of PRP, and I feel like the patients who do the best are the patients who come in and we've already kind of looked at some of their hormone levels. Obviously, if you come in and you're in decent health and you're eating a pretty clean diet, you're starting to exercise, we've looked at your hormone levels, those patients are going to have a much more profound response. But I've also seen patients who were not in great health have a good response. It just depends on your genetics and kind of what you bring to the table. As
Sure.
far as the discomfort, it's actually not an uncomfortable procedure. You have numbing cream on for 20 to 30 minutes, and the procedure itself takes less than 20 minutes.
Okay.
So I feel like the results, I would say they vary, but most people are very pleased. I also feel like both of those procedures work best if you plan on getting a series of three. They say
Okay.
that the first PRP procedure kind of undoes some of the infrastructure damage. And then number two and three are like part of the rebuilding process.
Sure. And then like every 6 weeks, or what does that look like as far as treatment planning?
What's recommended is to get 3 treatments at 4 to 6 weeks apart. But I have had some patients who have, because of their schedule, have had to space it out a little bit further. There's no exact, like you have to get it in 4 weeks or you're going to lose ground. And then a lot of patients will do maybe once a year or every 18 months as kind of a maintenance. Again, it's only there to further benefit and enhance the effects. So it's not a detriment to repeat the procedure. It really helps with blood flow and vascularization.
That's great. So you said, especially for men, more sensitivity and ability to achieve erection, and then for women, more like ability to orgasm, lubrication, those kinds of things.
Absolutely.
Great. That's awesome.
Yeah. Like I said, I feel like the PRP is amazing as a standalone,
Mhm.
but the patients that get the really Shazam experiences are people who have also come and had their hormones looked at. And when I say hormone optimization, it's kind of a broad category, if you will. It's health optimization, but hormones are a big part of that. So we look pretty expansive lab panels. We're looking at your vitamin B12, we're looking at your vitamin D levels, which is a hormone, fasting insulins, your A1C. But then we look at the hormones: thyroid, testosterone, progesterone, estrogen. We are looking at DHEA. These hormones are so important. And again, as we age and, we breathe in toxins from the air, we take in pesticides in our foods. Even if you're eating an all organic diet, we know that we're taking in carcinogens from our world. And when you look at the root causes of some of the problems that we have from a sexual standpoint, a lot of times it's from hormonal imbalances or damage to our DNA, damage to our cells. So we help people tune up their nutrition and start exercising and getting their body moving. And then we replace hormones. So we look at testosterone levels and we look at estradiol and progesterone levels, DHEA. And again, we replace where there's deficiencies.
Mhm.
And sometimes you can replace and people don't have an optimal response. Again, then we look at more specialty testing to kind of figure out what's going on. Maybe they're missing some micronutrients or they've got an enzyme issue. So this is the really cool thing about this medicine, is that a little bit of a jigsaw puzzle, but if you're willing to put the time in, we can figure out what's going on and get people really feeling amazing.
So let's talk real quick about kind of what you can expect from hormone therapy. So I guess there's two ways to look at this. Either what symptoms are people typically having when they have some hormonal imbalances or deficiencies, or what results do you think are most common, or benefits do they get from doing a hormone therapy treatment or optimizing their hormones?
Well, I think it's different for men and women, and I think sometimes these can be stratified into age categories.
Mhm.
I would say the number one reason that men come to see me for hormone optimization is that their penis isn't working the way they want it to. Either their erections aren't as firm or they can't last as long as they used to. Sometimes it's also they've gained some midsection belly fat, or they're tired. Sense of well-being for men, sense of masculinity and
Yeah.
assertiveness and confidence has been affected. For women though, especially the perimenopausal women, I feel like the number one complaint is loss of libido. They just have no desire for sex whatsoever, and they're exhausted all the time.
Mhm.
Weight gain is a common problem too, as our stress levels keep going up and our adrenal support goes down and our hormone levels kind of fluctuate and body fat hangs on to estrogen. And so there's those imbalances cause a lot of symptoms for females that are more related to their energy level. They're just tired and napping and they're chasing their energy with
Yeah.
caffeine.
Yeah.
So I think it's different between men and women, but I feel like what happens is that when you optimize someone's hormones, whether they're male or female, they didn't realize kind of how crummy they felt until they feel great.
Mhm.
I feel like most of us are going to outlive our parents. Not all of us, but for the most part, medicine is better. Most people care more about their health than our generation ahead of us. But how do we want to finish this race? That's the real question. And robust sexual health is good for your mind. It's good for your body. It's good for your relationships. And it's just not talked about enough. And I think it's super important. So we're here at Vitality to help you get there. So come and see us so we
Yeah.
can help you feel great.